This is the Provider Program, your VIP look into what's happening in Tallahassee. FHCA's Provider Program is brought to you by Bouchard Insurance, Medline Industries, and Healthcare Professional Consulting Services. And now, here is your host, Emmett Reed.
Hi, I'm Emmett Reed, Chief Executive Director of the Florida Healthcare Association. I want to welcome you to the first edition of our live provider program here from Tallahassee, Florida. As all of you know, it has been a crazy year this year with COVID-19 really shutting everything down, including, for the most part, Florida's capital. So Lobby Wednesdays look different. We can't have you up here like we always do. So we thought, what can we do for our members? And we said, we're going to bring Tallahassee to you. And that's what we're going to do every Friday live to give you the latest on what's happened at the Florida legislature. And this week was the opening week of the 2021 Florida legislative session. And it was a very active week. We've got a lot to tell you about in a very short time. And I'm glad you could join me today. We couldn't do this without our sponsors. And so I'd like to thank our sponsors, Bouchard Insurance, Medline, and Healthcare Professional Consulting Services Incorporated. Really, we couldn't do this show without our sponsors. They're always there for us, helping us out with these type of events, bringing the latest to you. And we couldn't thank them enough. We would ask that you, as members, make sure you give Bouchard, Medline, and Healthcare Professional Consulting Services your time when they call on you for a visit. So thank you again to our sponsors. Now, let's get right into the program. We have our brand new Chief Lobbyist for the Florida Healthcare Association, Toby Philpott. Toby is going to go over lots of information with us, but I want to give you a little background on Toby. Before Toby came to us, he spent 5 years as a chief of staff at the Agency for Healthcare Administration to the secretaries, 3 different secretaries. So he knows our issues backward and forward. And today he's going to talk about COVID liability protections, which there's lots of excitement going on there, the financial impact of the pandemic, and the personal care attendant program. So Toby, welcome to the set. How are you doing today?
Emmett, I'm delighted to be here, and thank you for the privilege to lead the advocacy efforts on behalf of this association. And as you noted, we had a very busy week. It's been a unique and unusual start to this legislative session. As you know, most everyone in Tallahassee, as well as across Florida, are monitoring committee meetings virtually. In the Senate, we're having to testify remotely from the Civic Center. And so that presents some unique challenges, but a lot of the pageantry of opening day wasn't there just due to the safety protocols. But as is tradition, the governor opened the session by giving his State of the State address, in which naturally a large majority of his remarks were the state's response to COVID-19. And the governor was direct, he was deliberate in his remarks, and he was effusive in recognizing the valiant efforts of our long-term care staff in protecting Florida's frail elderly. Equally important were remarks from the Senate President Wilton Simpson, as well as House Speaker Chris Sprouse. Senator Simpson noted the valiant efforts of our staff to protect Florida's frail elderly. He noted the challenges of having to adapt and respond to CDC guidance, state guidance, local guidance, and oftentimes where those directives were in conflict, and recognizing the challenges that we've had with PPE and giving his support. The Senate President lended his support to the healthcare liability bills, as did the governor in his State of the State. So it was a unique opening to the legislative session. It's been a busy week, as you mentioned.
Well, so you're telling me that that they mentioned COVID liability. Everybody's talking about it. So where is it at in the legislature right now, and how's it shaping up?
Well, both bills, the House Healthcare Liability Bill as well as the Senate Healthcare Liability Bill, were heard in committees this week. They were heard at the second committee of 3 committee stops. The House bill was heard in the Pandemic and Public Emergencies Committee that's chaired by Tom Leak, a dear friend of this association. And the Senate bill was heard in Senate Health Policy that's chaired by Manny Diaz. And as you know, we had dinner with Senator Manny Diaz 2 weeks ago, and it's been a strong supporter of our issues here at the association. So both bills passed out of their committees favorably, largely along party line votes. And I will tell you that much of our work this week, the government affairs team work, was defeating amendments that would try to weaken or limit our protections. The trial bar has been very busy, and we have been responding to that. We've been playing defense. We were able to defeat an amendment that would have extended the amount of time for a plaintiff to bring a lawsuit against a long-term care facility. We were successful in defeating that. Equally important was defeating a very egregious amendment filed by the trial bar, which would have denied protections to our long-term care facilities for any facility that had had at least one violation of infection prevention control in the last 3 years. So this week was largely playing defense. Those bills are going to advance to their third and final committee stop. And as you know, these committees are there to really refine the language and the substance of the bills. And so there's one more committee stop, and then they'll proceed to the House and Senate floor.
So the bills, what I'm hearing is the bills are moving along. They're not quite as strong as we'd like yet, but we're trying to hopefully communicate that we need some more protections. But all in all, everything's still moving. It's still alive, which toward is never easy. So that's a good thing.
Absolutely. Everything's still very much alive. We've been on offense working with leadership in both the House chamber as well as the Senate chamber to make sure that all the protections that we need are in those bills before they hit the House and Senate floor. I would imagine that the bills could be heard in their third and final committee stop as early as next week. There's some real momentum here to get this done early in session. I know the governor would like to see it done early in session. And so we have met with House leadership all week on a range of issues that are important to our industry, and we'll continue to meet with members across next week.
So not just the COVID liability bill, but any of our bills, how can our members, they're stuck at home, how can they help?
Absolutely. Well, what we've been trying to do is create meaningful interactions with our membership and members of the legislature. And Melody Arnold on my team has been working to set up Zoom opportunities for frontline direct care staff as well as administrators to interface with legislative members on important issues, principally liability protection, but funding is critical, as well as the PCA program. And we've gotten a lot of traction because we know the most powerful voice we have. It's not me, it's not our lobby team, it's our members that really can give that frontline direct perspective of what the challenges have been over the last year, the stress and strain of this pandemic. And that's the most powerful voice we have. And so we're going to continue to create those opportunities. Unfortunately, they have to be virtual this year because the Capitol's closed, but members have been very receptive. Our legislative members have been very receptive to meeting with our members virtually, and we're going to continue to do that across the next 9 weeks of session.
Great. Now, we got another issue, the PCA bill. What's happening there?
Well, I will tell you, I know we're gonna have some video later in this program from Sam Garrison, who's our House sponsor. Our Senate sponsor is Senator Aaron Dean. He has been a longtime friend of this association and a champion of our issues. And I know we've got a video that we're gonna show later, but what's been really important in our testimony on the liability bill is having members of our association come up and testify. And I am delighted. This past week, we had the chief nursing officer of Avante, Kim Bigashevitz. She gave incredibly—
By the way, great job on the name. Most people call her Kim B. That was awesome.
Listen, I've been practicing all week, and I will tell you, she gave incredibly compelling testimony in both the House committee as well as the Senate committee. And I believe we may have some video of that for everybody that's watching.
Let's watch it.
Barbara, that was a minute and a half. Thank you, Chair. That was actually pretty close. Bigashevitz. Good afternoon, and thank you, Chair and committee, for allowing me to speak today on behalf of all of healthcare workers, but in particular, long-term care facilities. I'm the Chief Nursing Officer for the Avante Group, and I oversee 13 care centers across Florida. This COVID pandemic has been the most challenging experience for any of us in the front line. This has been something that none of us could have ever imagined. It's been a long year, and my staff are physically and mentally weary. Yet we continue to fight every day. The last thing we need is added anxiety of having our decisions second-guessed by attorneys and others who can't imagine the pressures we've had to endure. Lawsuits affect every single member of the nursing center team, the administrator, the nurses, the CNAs, and we're all in this profession because of our love for the residents. Unnecessary lawsuits put doubt in their minds that they haven't given their all. But I'm here to tell you they've given more than their all. They are truly the heroes of long-term care and truly the heroes at the front line in this battle. Can you imagine what it does for staff morale when they see billboards and hear commercials with lawyers claiming to be the protectors of those we're caring for every single day? It's as if the plaintiff's attorneys are saying we didn't do enough It's as if they're second guessing our every move when every move we made was for the health and well-being of our residents. I thank you for bringing this bill forward, and I urge you to say yes to continue to protect these heroes. Thank you.
Oh, wow. That was very compelling testimony. Kim, you did a great job. Thank you so much for coming all the way to Tallahassee to do that. And Toby, I know you're going to be back to talk a little bit more about the PCA bill, but we certainly appreciate all your efforts and look forward to talking to you in a few minutes. But right now we want to take a break and hear from our sponsors.
Program is brought to you by Bouchard Insurance, offering exclusive insurance programs for FHCA members. Medline Industries, the leading post-acute medical supplier with solutions to lower readmissions, improve customer satisfaction, and help improve survey outcomes. And Healthcare Professional Consulting Services, delivering premier business and financial consulting in areas like revenue cycle management and compliance guidelines for Florida's long-term care communities.
COVID was challenging for everybody. I know a lot of times you saw it popularized on the news with what was going on in New York and in the hospitals, but not much light was given as to what was happening to the long-term care facilities and the challenges we face. I guess you could say we're kind of overlooked as far as the severity of the impact. And we were faced with a lot of the same things with the shortage of PPE, the staffing challenges. We were also risking our lives from exposure with the patients as well as the staff. One time, I know when we had the outbreak, and I personally called every family member to say, hey, so such and such tested positive. That's just taxing and distressing because you feel for them on the other end as well, but then you also, because COVID is new for all of us, and then worrying about, if they're gonna think you caused it, that kind of thing, and knowing that you have no control over necessarily transmission, or who gets it, who doesn't get it, or when they test positive and when they don't test positive, or when they were exposed and when they weren't exposed. Your only due diligence is to make sure they recover quickly and recover well. I think most nurses and most healthcare workers, nurses and CNAs, and even physicians have some form of PTSD from the impact of what we dealt with COVID that people do not see and people don't realize.
All right, welcome back to FHCA Provider Program Live. I'm Emmett Reed, Chief Executive Officer and the Executive Director of the Florida Healthcare Association. And I want to thank all of you for watching. I know we've got a pretty big contingent out there watching us live, sending us encouragement, which we love to hear, but we'd also like to hear from you. So we have a chat feature, if you're watching this, that you can ask questions of us live, and we'll answer them as soon as we get them. So please make sure you use your chat feature to ask us questions. And I know everyone has questions on the topic of money and funding and what the budget's going to look like. So we've brought on our Senior Director of Reimbursement, Tom Parker. Tom, welcome to the show.
Thanks, Emmett. Glad to be here.
Yeah, you've had a busy week already, and I know you've got some great insight on Florida revenues in general. What's going on with the budget?
Thanks, Emmett. So, when the state shut down last year in March for a few weeks there, and then, some of the industries remain closed longer. Obviously, we still don't have cruise ships open. Disney's still operating at limited capacity. Hotels are down. In a state like Florida without a state income tax, all of that revenue is significant to funding the state budget. So our legislators are in a tough place this year with the decisions they're going to have to make. As of now, the numbers look like about a $2.7 billion reduction they're going to have to take out of about a $35 billion budget. Yeah. So it's sizable. We're obviously watching some of the stuff that's going on in Washington right now and what that may do to change some of those revenue numbers that they're looking at. But they're gonna have to look at large cuts to meet that deficit number. Obviously, so that means they go to the big budget silos. Education, healthcare. Those are the two biggest pieces of the budget, so they're going to be going there. Member projects are going to be looked at closely this year. So we expect it to be a tough budget session, but I think it's always a tough budget session. So
yeah, I think in particular this year is harrowing. But the governor did put his budget out. What happened to us there?
Yeah, so we did see the governor's budget recommendations a few weeks ago. They are just recommendations, but it's always a better place to be in those recommendations than not. So from the nursing home perspective, the governor did recommend fully funding the nursing home line item, including the $105 million rate increase we were able to work out last year. He also included a continuation of the lowered lease bond threshold, so that would not trigger another round of collections. And then no changes to the prospective payment system as we come up to October 2021. The next rates is the first year of the rebase, and as we start to transition the hold harmless. So there's no proposed changes to that in the governor's budget recommendations.
Good. Okay. Well, that's good news. It's a good start. Started really good there, and then we had a committee meeting in the House yesterday that I actually testified, but you were a witness to it and helped prepare me for it, obviously. So why don't you let our members know what happened there?
Yeah, Emmett, you did a great job. I know it was not a friendly place to be in yesterday. As I said, they're going to be making some really tough budget decisions this session. So one of the places they're really looking at is entities who received significant federal money through some of the different stimulus bills that were passed. And obviously, nursing homes did receive a significant amount of money, about $635 million in Florida alone. But, we really wanted to stress with the House that, that money was really nothing more than a lifeline. And without it, many of our members may not be here today. No one was able to, get rich off that money. It all went to COVID expenses, whether that be additional staff raises like hero pay, PPE. We know that the cost of PPE was incredibly high early in the pandemic when you could find it. The significant testing costs that everyone's still going through even today. The cost around setting up COVID isolation units and making sure that you could keep your residents safe. We know that you spent significant money on all of that, and you did a good job sharing all of those costs yesterday. And really talking about the pressures on revenue from empty beds. I mean, we're down as a state at about 12% today at an occupancy level, and at the peak of it, we were down about 18 to 20%. So we're coming back slowly, but obviously we're not close to where we need to be to make this thing work financially. So, I think that we're going to probably be in a better place to start with in the Senate than the House, but we've been there before, and Toby, Emmett, myself, Melody, our whole lobby team will work hard for you guys every day to really tell those stories of where that money's gone and how you're using it to really protect your residents and pay your staff a wage that they need to continue showing up during these trying times.
Well, here's the good news. Okay. The good news is we're on the high ground. We know, and you know, that you spent the money on what was supposed to be spent on. It's incumbent upon the legislature to ask those tough questions. And the great news is we're willing to share. We're going to be an open book and share with them what the expenses were for. And Tom, you've done a great job working with them, and I know our entire team has, and we certainly appreciate you and all your efforts. And I know your reimbursement committee is very active in helping with that as well. Again, members, we're a member-driven organization. We need you. So if a member wants to help the cause, how can they help?
Sure. Email me, call me. My cell phone number and email are on our website. Love to talk to members anytime about anything. If you've got some good data points you want to share about where that money's gone and what you've done with it, I would love to hear it. Obviously, I'm not in the building every day like you all are, so your stories are really powerful. So please reach out.
Awesome. Thanks, Tom. We appreciate you.
Thanks, Emmett.
All right, let's take a quick break, and we will be right back.
It's like my grandpa or my grandma, and most of them don't have family, so we basically are their family, like getting them through the day and everything like that. The biggest thing is putting a smile on their face, hearing them laugh and share stories about when they were younger or things that happened in their life.
Once again, Emmett Reed and now Toby Philpott has joined us again. And I think in the break, we did receive a question. So the question was about minimum wage. So Toby, you want to address what's going on with that?
Yeah, as you know, Emmett, voters across Florida passed Amendment 2 in November that would increase the minimum wage over the next few years to $15 an hour. The Senate President addressed that and said we need to be mindful of that increase as we're planning budget and looking at projects. We know as it relates to our industry that we're going to see wage compression. We know how difficult it is that we're drawing from a labor pool that is competing with Chick-fil-A, Target, Amazon, Walmart. Many of those companies are already paying $15 an hour. So we're going to see wage compression, at the CNA level, at the PCA level, and those wages for, whether it's dietary or laundry, as those increase towards that $15 an hour over the next few years, we're going to see that wage compression. We're very mindful of it. We're already having conversations. Tom Parker has been, leading those conversations with the House and Senate Appropriations Committee staff as well as members. And I think everybody's mindful of what we're going to see in terms of wage compression.
Okay, great. Is that it for the questions for now? Okay, keep those questions coming in. Remember, you have a chat feature right there on your screen. If you want to know anything, we can help you out with anything. Please ask us. All right, so Toby, we touched on the PCA bill a little bit earlier today in the show. We know that there is a huge amount of pressure on you all for workforce. We understand that. And so the PCA bill is just one small way. Well, you would think it would be a small way to help, but apparently some groups think that it's not such a great idea. Tell me what's going on with the bill.
For a program that has been so well received by our members, in every conversation I have with members across Florida, staffing comes up. We had acute staffing challenges prior to this pandemic. The pandemic has only exacerbated those staffing challenges. We were just talking about competing with, we have a labor pool that we're competing against these other industries. And for what this association was able to do last March, working with the Agency for Healthcare Administration and certainly the help of the governor's office to put this personal care attendant program in place. It's tied to the governor's executive order 2052, which was just extended for another 60 days. So the PCA program is extended as well with the executive order. But for a program that has been a lifeline in many senses for our members, we're seeing it's different when you're, trying to put something in law permanently, right? This is a temporary program as it is now, tied to the executive order. Lawmakers certainly want to be deliberate and intentional when they're thinking about putting something permanently in law. But we have been working to educate staff as well as members on what a value add this program has been for facilities across the state of Florida. And we've garnered the support of the Associated Industries of Florida and the Florida Chamber, who really view this as a workforce development issue. We also have the Florida Council of Bishops. But to your opening question, AARP has done everything they can to diminish the prospects of this bill, to torpedo this bill, candidly. And I believe that the House bill could be up and introduced in the House. That's House Bill 485, sponsored by Representative Sam Garrison, who has valiantly been leading the charge, talking with members of the House about the importance of this for the long-term care community. It could be up as early as next week. And so we've lined up a number of folks and members from our association to come and speak on this bill. I know a number of you have written letters of support on behalf of the PCA program, and I would encourage others to do so. If this program has been a lifesaver, if you've been able to leverage PCAs and certainly over that 4 months they've become CNAs, please, we'd love to work with you. Melody Arnold, our Associate Director of Government Affairs, has been leading a lot of the discussions on the PCA program, but we're going to encounter some resistance from AARP and certainly the unions, I'm sure, will be vocal, but I believe that we're on the right side of the issue. I know we're on the right side of the issue. And by and large in our discussions, the membership of the House and Senate feel very comfortable with the merits of the PCA program.
Now, you talked about Sam Garrison. He was here earlier this week, right?
He was. He came over, and I know you had a chance to talk to him as we were preparing for the introduction of this bill, and I believe you had an opportunity to have a conversation with Sam.
Yeah, yeah, we did, and we've got video of that right now, so let's take a look at it.
Bill called personal care attendant, right, is what it's specifically addressing. Tell us about that. Tell us about the bill.
Sure. The bill is designed to give, put into law some of the protections and I'd say the updates to the statute that we're dealing with during COVID, which is primarily understanding that nursing homes have an increased need, given the time we're in now, for flexibility in terms of how we staff our homes. What this bill would do is put into law what's currently existing right now under the governor's executive authority, and would have what's called personal care attendants, which are folks who are part of the system to assist with basic needs to make sure that our seniors have the care they need.
Well, and we certainly appreciate that. And under the governor's executive order, we have seen already 2,000 individuals choose to go into long-term care because of this PCA designation, the emergency order. So you're just saying, look, we can get this into law. This is going to help more people address a staffing crisis that's in nursing homes.
Look, the folks who do this work are the kind of the underappreciated folks that we call healthcare heroes. These are the folks who are on the front lines doing the things that are just tough jobs. There's no glamour, no glitz involved, but this is what is necessary to make sure we have people in place that can do these essential functions to ensure that our residents and long-term care facilities have the attention and the care that they need to be safe and secure.
All right, welcome back to the FHCA Provider Program Live, coming to you live from Tallahassee, Florida. Here in the last few minutes, I'm with Chief Lobbyist for the association, Toby Philpott. Toby, if our members want to get involved, how can they get involved?
Absolutely. Well, as you mentioned earlier, Lobby Wednesdays is looking much different this year. We're having to leverage.
We miss you guys.
We do. And you are a most powerful voice. I wish you were here and we could walk the halls, but the Capitol's closed. So we're leveraging platforms like this. We're leveraging the Zoom meetings, and the Melody Arnold setting that up. We were really doing Lobby Wednesdays by districts and focused on single issues. So whether it's liability protection, we may set up, several different facilities in the district and talk with members of the committees. The next committees are obviously the Judiciary Committee in the House and the Rules Committee in the Senate. So we'll be reaching out to you by district to have members talk with, and administrators and staff talk with members over a virtual platform. I also will make sure that everyone that's tuning in today will have a list of the committee members for each of our issues. So we know that the liability bill is going to House Judiciary and it's going to the Senate Rules Committee. I will make sure you have a list of those members so you can give voice to the need for those protections. Certainly as our PCA program, personal care attendant, is heard, we will make sure that members that are watching today have the list of the members of those committees so they can reach out by email or phone call. And I'm certain we'll be doing a letter writing campaign on that as well. And so everything we can do to create meaningful interactions in a virtual world to reach legislators is what we're doing. That's where we're targeting our efforts, Emmett.
Awesome. Thanks, Toby. And listen, but we've heard right now over 2,000 PCAs have challenged for the CNA test. If you have had that happen in your facility, let us know. We want to hear about that. Those personal testimonials are powerful, and it's a great way for us to get our message across. So that's how you can help us virtually at your home up here in Tallahassee. Well, that is going to wrap up our first ever live edition of the FHCA Provider Program. I am so glad we got through that without too much craziness going on, but certainly appreciate Kristen Knapp and her team for putting this together. And we're looking forward to coming to you live every single Friday. Thank you, Bouchard Insurance, Medline Industries, and Healthcare Professional Consulting Services Incorporated for your sponsorship. We couldn't do it without you, and we definitely couldn't do it without our FHCA family. Thank you, and we'll see you next week.